Now let us demonstrate the female genital organs. These are the two ovaries, the uterus, the uterine tubes, the vagina, and the vulva. This is the left ovary. This is the left uterine tube in the free border of the broad ligament. This is the body of the uterus. And this is its fundus. This is the right uterine tube. And this is the right ovary. This is the cervix of the uterus. This is the vagina. This is the urinary bladder lying in front of the vagina and uterus, and directly behind the symphysis pubis. This is the retropubic space between the symphysis pubis anteriorly and the bladder posteriorly. This is the parietal peritoneum reflected from the anterior abdominal wall onto the superior surface of the urinary bladder. Let us continue with the reflection of the pelvic peritoneum. The peritoneum is then reflected from the superior surface of the bladder onto the lower or anterior surface of the uterus, where it forms the uterovesical pouch. Notice that the base of the bladder lies in contact with the upper part of the vagina and with the front of the cervix, and is not covered by peritoneum. This is the bladder, urinary bladder. This is the ureter. And this is the base of the bladder. Here is the anterior wall of the vagina. This is the cervix of the uterus. And this is the body of the uterus. This is the peritoneum, which comes from the upper surface of the bladder directly to the lower part of the front of the body of the uterus, leaving the cervix bare. The peritoneum then extends upwards to cover the fundus of the uterus, and is followed downwards on the upper surface of the uterus and the back of the cervix down to the upper quarter of the vagina. From here, the peritoneum is reflected on the front of the middle third of the rectum to form the recto-uterine pouch or Douglas pouch. Note that the anterior surface of the cervix is devoid of peritoneal covering, and this is in contrast to its posterior surface, which is covered by peritoneum.